Good morning, everyone. What we had learned previous class, body, mind and society. Just like biology of behavior, mind and body, which had been learned in first year. Here, one more concept includes society, where we have been behave only in society. When we interact in this society, social situations have been affect our mind and body. Mind and body affected by social situations. Which leads to stress. Stress may be mild, moderate or severe. I would like to ask questions regarding previous class. What are the physiological changes when a man interacts with society? Anila Joseph. Anila. Anjali. Anjana Krishna. Silpa. Silpa. Anne Maria Anthony. Abarna or Gauri. Can you hear me? Anyone of the talk with me?
Yes, sir.
Yes, Gauri. Gauri, can you list what are the physiological changes when man interacts with society? You can see in this slide and read out. Gauri. Gauri, see the slide and read out. No need to think, okay?
Increased heart rate, rapid breathing, release of stress hormones, adrenaline, epinephrine, and
Why?
noradrenaline,
Next question is that
increase blood pressure.
Next question is that why rapid breathing happen? Why rapid breathing when we interact in the society and social situations? Reason why? We have been experiencing, some situations we having this. Reason why? So I was given shown on picture. Are you remember? Look at this. This is the lungs. When we interact with society, first affect our brain, mind. Mind will be influence pituitary gland, master gland. If unpredictable situations or undesirable social situations, that time our mind, body and mind try to cope with that situations. So pituitary gland secrete and stimulate adrenal gland. Where situated adrenal gland? Top of the kidney. Can you see that top of the kidney? Which is secrete adrenaline. Adrenaline is responsible for determine the heart rate, blood pressure, heart rate. So over secretion of adrenaline to cope with new situations, first heart rate will be changed. So which is automatically influence pulmonary arteries and lungs, which cause to rapid breathing. The body need more oxygen to cope with new situations. Okay. So lungs will be overactive and over breathing will be happen due to the need of oxygen to our all part of our body. Okay, Gauri, clear about it? Gauri? Yes. Gauri, clear about? Any question more than about it? Okay. Then system involves in stress. First system, enzymic system. Second, organic system. Third one, nervous. 4, psychological system. 5, social system, social cultural. Students, fact is that every individual having need fulfillment, we have been interact with society, social components, which directly affect the mind and nerves, organs. Enzyme means digestive system, a component of digestive system, enzyme, which determine digestion. So according to Gringer, these are the system involved in the stress. Next concept is that biosocial resonance. The situation of information incompatibilities will lead to change in central nervous system, autonomic nerve system, neuroendocrine system. The systems affect susceptibility to disease becomes greater. So this is a wonderful concept, biosocial resonance, which means a person interact with society biology of chemistry of our body will be changed according to our interaction. If positive interactions, pleasant body chemistry, is negative interaction or any interaction which cause or unpredictable, undesirable, what will happen? Our body will be secrete stress hormones. Chemistry of body will be changed and cause stress, which leads to diseases. Look at this, low stress, next topic is that, look at this. I'm sorry. Types of stress, next heading. Short, moderate, severe. Short means public opinion, public appearance. First time in front of class or first time in public speech. Second, moderate, overwork. Severe, prolonged separation of loved one. So next we are going to detail about, look at this, relation between stress and performance. So fact is that, short and moderate stress is need for good performance. Severe stress only cause to diseases. Here, look at this. From this picture, Bell curve, we can easily identify about. Low, x-axis performance, x-axis stress, y-axis performance. Low stress, no performance, boredom, depression, then increasing stress gradually due to increasing attention and interest, due to interest of our likeness. And performance will be top. Optimum stress, which means moderate stress, which leads to optimum performance. Then overstress, anxiety. In time of anxiety, what will happen? Difficult to perform. Then increasing high stress, which completely melt down. Nothing to do, depression, and happen mental as well as physical illness. Low stress, no performance, sleep, inactive. Optimum stress, high performance, healthy tension, motivation, focus, concentration. We can make concentrations. Stress overload, performance down, fatigue, exhaustion. High stress, low performance, and panic. So high stress only happening the diseases, and other stresses you need for performance, good performance. Next, types of reaction to stress. Normal, defense reaction. Second, neurotic, defense is ineffective. 3, psychophysiological, defense fails. At this time only a person affected by mental illness as well as physical illness due to stress hormone and imbalance of chemistry of body. So what is normal? Defense. Every individual should be defense against stress. That's why we had been learned in psychology. Or you remember defense mechanism? Remember? Manju? Different types of mature defense mechanism. Immature defense mechanism we had been learned. So that is, everyone should keep it in mind that should be defense ourselves against stress. Adopt matured defense mechanisms. Next section is very interesting one. New topic, suicide. In 1897, Emil Durkheim was conducted a study why a person committed suicide. Then he was classified 4 types of suicide. First one, egoistic, due to not well interacted. Example, military officer who is suddenly retired. After the retirement, there is no way to interact as in the military camp. So it leads to suicide. Second, altruistic suicide. Social interaction is too strong, will interact. Example, military man Sam Rice, cutting stomach. Sam Rice, Second World War, unable to protect their own country, they suicide themselves due to their love their own nations. In modern days, example, love failures. For example, 2 boy and girl, so much of interaction, exchange of materials, everyday talk between them, mobile phone. So end of the love may be fail due to family, or boy may be cut off their love. What will happen? Girl try to suicide, or both of them run away from house and may cause to suicide. For example, love failure. Everyday newspapers we could see nowadays. Then anomic suicide, due to regulatory system collapse. For example, if a person normally living in a society, interact with every sections of the community and society, one day the person cut off from their own groups, for example, any professional groups, the person difficult to tolerate that situations, unable to interact with one section of the society, and try to suicide. Fourth one, regulatory system, fatalistic suicide. Regulation excessive, mainly irrational regulations. Example, student suicide in hostel. Various histories we having this. In hostels, over regulations, or in colleges, mainly irrational regulations which leads to suicide. as well as the regularly we could see in this the time of 10th result, 12th result. A student may brilliant student. The father and mother threatening to student, their own child, if not win the exam, I will do like this, like this, like this. But in the examination, God failed. What will happen? In the family house, father and mother having over regulations and was committed suicide. So 4 types of suicide due to the social interaction. Look at this graph, shows detail about it. Fatalistic suicide, many rules. Anomic suicide, no rule. No rule means a person cut off from that particular part of the society. Fatalistic, over-regulation. Then strong interaction. Because the strong ties, altruistic. Then weak interaction. Nothing, unable to interact with other people, lonely, egoistic. So what do you think about what is safe area away from the suicide? We need interaction, but over interaction or purposeless interaction, which is very, very important, okay? Needless interaction, which is ended with suicide. Then regulation, we need regulations, but irrational regulations cause to suicide. So this knowledge is very important for us when in clinical setting to educate the person who affected by or the suicide attempt. You can also teach, educate the people in the community setting as well. So that's why the World Health Organization says that this is greatest threatening to health. Look at this. Suicide is the second leading cause of death among 15 to 29 years old. Just imagine. So we are healthcare professionals need to concern in community setting, clinical setting, create awareness regarding suicide. And what are the reason? Many people don't know about what is the main reason for suicide. And protect the people. Over 800,000 suicide every year. One death every 40 seconds. Mainly, pesticide, hanging, as we know that. Frequently we have been hearing this news. Suicide. We are nurses, our role is that classify which type of suicide is. If a patient comes into hospital with suicide attempt, try to assess the client and identify which type of suicide is that, whether altruistic or fatalistic, and according to that, give guidance and counseling. Symptoms of suicide. Talk about suicide. Always talk about death. I am going to kill myself. I wish I had not been born. So these are the words, negative words used. Second symptom, getting the means to take own life. For example, purchase gun, pills. Then withdrawal. They do not interact with other people, don't like to interact with other people. Fourth one, mood swing. Example, emotionally high and low, discouraged. Fifth one, preoccupied with death, violence. 6, feeling trapped or hopeless. So this is very important area, the symptom. There is no hope in the life or purposeless life. 7th one, increase intake of alcohol, drugs. Students, this is other area. A person having alcohol and drug mainly expected is suicide tendencies. 8th one, changing normal routine. For example, eating, sleeping pattern have been changed. 9th one, doing risky, self-destructive things, driving recklessly. Then giving away belongings. So you do not talk with family members. Saying goodbye, people. Developing personality change. Now, one person may having good positive personality. Immediately change that personality into negative personality. So that situation symptom to suicide. Then measures to prevent suicide. Restricting access to means, which means alcohol means reduce, and other means, for example, gun purchasing and other means of. Second, media reporting, responsible media. As we know that media may be negative influence. So promote positive to prevent suicide. Third one, introducing alcohol policies. Fourth, school-based intervention. School-based intervention is very, very important. Every child should be know about what is meant by suicide, what are the causes of suicide. So which create awareness and away from suicide. So we are nurses having lot of opportunity through school health program and school health nursing services we can do. Fifth one, early identification and treatment. Identify symptoms and try to treat. Sixth one, training for health workers. Training for health workers regarding the suicide, and mainly the training given to low level workers, mainly the nursing professional and other levels of workers, to in the time of domiciliary visit create awareness regarding suicide and prevent. Seventh one, follow up care and community support. Next section, importance of individualization and socialization in nursing. First, what are the importance? Already we have discussed. First important, care. Nurse should be assessed whether a patient individualized or socialized. So that oriented care, client oriented care. Second one, cure. Individualization is a medicine, social medicine. Socialization also a effective medicine to treat various diseases, as we have discussed earlier. Then prevention, prevent communicable diseases and non-communicable diseases, prevent suicide mainly, mental illness, socialization and individualization is very important for nursing. Then promotion of health. Promote physical health, mental health, and social well-being. The individualization and socialization is essential. Nurse should be prescribed. This is a medicine. This is a sustainable medicine. All other medicines only controlled. But this medicine is sustainable, lifelong. There is no side effects. Fifth one, nursing management. Mainly hospital management, ward management, disease management, planning, nursing plan, nursing organizing. In every aspect of management, we can utilize this knowledge. Sixth one, health education. To educate individuals, families, as well as in school level, community level, we need to prescribe the individualization as well as socialization can cure, prevent, and promote the health. Every disease we can prescribe this medicine. Then counseling. Nurse is a counselor, should be guide the client by using this knowledge. Eighth on nursing research. This concept used to formulate research problems. Tool formulation. Data analysis. Data interpretation. As well as we can test the hypothesis and fruitful result by using this knowledge. Then all nursing discipline use this knowledge. Maternal health, pediatrics, medical surgical, mental health, community health nursing. So every specialty nurses should be use individualization and socialization as a medicine to prescribe every patients in every setting to promote health as well as sustainable treatment. Mainly when you read the books of specialties, we can see these all the birds. In mental health nursing concern, various diseases due to lack of socialization, various psychotherapies based on individualization and socialization, as well as medical surgical chronic disease management. This is a sustainable medicine. For example, BPA, already we have discussed. Stress, there is no pharmacological medicine. Every medicine only control is a time being, never cure. Socialization and individualization is only resolution to cure the diseases sustainably, make life become happier and healthier. Summary and conclusion. Hence, concepts such as, what are the concept learned we had? Individualization, socialization, interaction of body, mind and society, interdependence of individual and society, directly affect or influence health status of people. So it's a social medicine, essential to apply in every sections of nursing: care, cure, prevention, promotion and rehabilitation. And it is also used to solve the social problems. So we are healthcare professionals, need to think about healthcare problems, also allied problems, mainly poverty, unemployment, illiteracy, juvenile delinquency, drug addiction, drug abuse, alcoholism. Only solve this problem have been solved by individualization, socialization. Then promote sustainable development. Promote sustainable peace and development. Review questions. Define following: individual, individualization, society, tribal society, agrarian society, industrial society, personality, personal disorganization, Socialization, stress. List the following: origin of society, 3 elements of society, characteristics of society, characteristics of tribe, tribal problems, tribal welfare, features of agrarian, role and functions of nurse, difference between society community, which is very important in the examination. Okay, difference between community and society most important. Causes of personal disorganization, approaches to study of personal disorganization, characteristics of socialization, importance, factors, theories of socialization, agencies of socialization, elements of socialization, types of socialization, system involved to stress, types of reaction to stress, types of suicide, importance of individualization and socialization, short notes, society, individualization, characteristics of society, agrarian society, industrial society, role and functions of nurses in society, personal disorganization, man and society, socialization, socialization in hospital, in rehabilitation of patients, interdependence of individual and society, interaction of body, mind and society, importance of individualization and socialization in nursing, difference between society and community, individualization and socialization, essay on define socialization, discuss socialization in process in hospitals, list the types of society in India, explain each types, point out their health status. Now, types of society in India, explain, for example, agrarian, industrial, tribal, etc. Okay, this unit is over. Promote happiness and job satisfaction and successful in the life. Okay, students, thank you everyone. Have a wonderful day. Enjoy the day. Thank you.